Hello and good evening. I'm Melissa Idris.
And I'm Sharad Kutan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Now, last week, Director General of Health, Dr. Nur Hisham Abdullah said that Malaysia had succeeded in flattening the curve and is now in the recovery phase of the fight against the COVID-19 pandemic. However, there are other experts who disagree. Joining us on the show is one of those people. He is Dr. Amar Singh, Senior Consultant Paediatrician and retired from the Ministry of Health. Amar, welcome to the show. It's good to have you here.
Thank you. Glad to be here.
Thank you for joining us. Now, Amar, you argue that Malaysia is not ready to lift the MCO. In fact, you say that there are still many issues that need to be addressed before we can do so. Can you begin by helping us make sense of how this argument, your argument, jives with that of what DG Hisham has said, that Malaysia is in the recovery phase, that the fact is we have recorded double-digit cases for the past week or so, and that is a good thing. So how does that jive?
I think that, of course, our DG Hisham is right, and our numbers are coming down, but we must remember that we are not finished with this pandemic. We're just starting out. If you can see slide 1, you see that I made a comment that what we've done with the MCO, with this restriction order, is that we've actually pushed our pandemic further down. We bought time for ourselves. We've dealt with this current wave and brought it down, and we've bought time to set up our health services in a greater measure. We bought time to train the public and prepare ourselves. But we're just starting out this pandemic. If you listen to everybody in the world, they say we're going to go in for perhaps a year or two into this pandemic. And so I think that what many Malaysians don't recognize is that we now need to be ready for the second wave. And that second wave is going to happen when we lift our MCO. If you look at the second slide, which is a slide coming from the Lancet shows this peak and then a reduction in the peak, which we are doing very successfully. We're bringing the peak down. But if you look at the third slide, the Lancet very clearly shows that actually there is going to be a second wave coming. When you release your MCO, people's behavior is not up to the mark if we don't put in all the right steps. But I think the Lancet diagram is inadequate. If you look at the fourth slide, you'll see my diagram on top of the Lancet diagram showing that we have an enormous second wave. And many people are worried that the second wave might actually be bigger than the first wave, because now we're talking about spread within our own country, not from visitors from elsewhere. It is actually embedded in our community. There's another diagram.
Can I interject at this point and ask you to help us understand, with your projections and with your sense of what this larger second wave might be, are we prepared? Have we bought that, with that time we bought, did we prepare ourselves for a bigger second wave?
I think that we've done some amount of preparation. We've ramped up some amount of the health services. We've actually tried to educate our public to some degree, but I'm not sure that we've got the message across in a major way into the public. I think that a lot of the public is still in a state of disbelief. Some of them actually are ready, of course, but some of them actually think that with the numbers coming down, that we're going to go back to where the way we were before. But that's not true, of course. We have to go back to a very different lifestyle. So my major concern and worry is not so much the Ministry of Health or the government, but whether the public is ready for the release of MCO in preparedness of their lives. Yeah.
Right.
If you look at the fifth figure, just to finish up, I apologize. You look at some work from Matt and Zin Benson. Matt Benson works with Pink City in Malaysia, and he's drawn this lovely diagram of waves coming our way. And with each wave, we'll have to actually put in more stringent measures. So I think most of the world recognizes that we're going in this direction.
Okay. Can I get you to clarify, Amar, why you argue that the second wave is going to be bigger? And talk us through the idea of community spread, because the first wave was really about the virus coming from people coming into the country. But now you're talking about community spread, and that could cause a bigger wave?
Okay, so if you look at slide 6, I talk about community spread as happening, and community spread is not linked primarily to the clusters. Right now, we're doing targeted screening, focusing on clusters. Now, I think the Malaysian public are all looking at the clusters. But if you look at slide 7 looks at Ministry of Health data looking at surveillance. Now, Ministry of Health is very good at doing surveillance. They do surveillance for 2 areas. One is for ILI, which is influenza-like illness, something that looks like COVID. And secondly is SARI, which are severe acute respiratory infections, which are the severe COVID-like infections. And they do this in about 13 hospitals for ILI, 8 hospitals for SARI. So these are people at random throughout the community being found who just come with an illness and we find that they're COVID positive. Now, if we screen every ILI and every SARI in the country, which are thousands, can you imagine the number of those people that we have in the community found with COVID positive? Right now, we're only doing sentinel sites, which means a few sites chosen. So this is very clear that we have community spread going on. If you look at slide 8, I've also shown data from the Selangor government, which is now doing random testing in the community. Now, the last about 3,000 that they have tested, they found about 7 people. They targeted people who are slightly older and maybe a little bit ill, and they found 7 people, again suggesting that it's unlinked people in the community.
Amar, is this just the natural way a pandemic progresses? I mean, once we've closed our borders, is it to be expected that the next phase of the pandemic spread or the chain of infection is through community spread? Isn't this anticipated?
Not just community spread, it's also going to be coming from outside. If you look at also that slide 8, you'll see also that there's data presented by MOH yesterday showing that 1% of those returning from overseas are also COVID positive. So we're still going to get reinfected from people coming back from overseas, especially from countries like Indonesia, for example, where the epidemic is growing rapidly. We also have a very large migrant worker population, maybe 5 to 7 million. And we recently shown that quite a number of them are also infected. And then we can anticipate that when we go back to work, when our migrant population go back to work, then there's going to be spread. So a lot of this is asymptomatic spread. People who don't show much signs but are spreading the virus.
I want to understand, some of the reports, because now everybody's reading about not just Malaysian situation, but also the global situation, the spread of influenza in especially temperate climates where they have several waves often. Does Malaysia actually experience that kind of influenza seasons? Do we have waves and is it reported at all?
I've seen some data from UMMC, University of Malaysia, showing some seasonal trends now in influenza, especially with our wetter months. But we don't have that sharp kind of trend that Caucasian countries have with winter. In fact, they're quite hoping that with their summer months now that COVID-19 will drop. But I think those of us who are in hot countries, and if you look at Australia as well, which is not really in winter right now, but in summer, I don't think heat seems to touch this virus very much. Yeah. But I do expect that certain times that there will be a higher rate of coronavirus than other times.
All right, we're going to take a quick break. Dr. Amar, we're going to come back and continue this conversation with you in just a couple of minutes. Stay tuned to Consider This. Welcome back to Consider This. I'm Melissa Idris, with me Sharad Kutan, and we're speaking tonight to Dr. Amar Singh, Senior Consultant Paediatrician, retired from the Ministry of Health. Now, he argues that Malaysia is not ready to lift the MCO, and I want to talk a little bit about data, Amar, about what the data has told you about the spread of infection of COVID-19 in Malaysia. We touched a little bit about community spread, but what else is the data saying based on the data that you do have?
Melissa and Sharon, I must say at this point that actually we know less than we should. All over the world, people are struggling to scramble to look for answers. I think, there's more that we don't know than we know. So there's a lot of uncertainty even when we look at the data. So most of us try and read every paper that comes out, all the opinions out there, especially from epidemiologists, and we like to listen to divergent and varied views. And I think that, what the data is telling us right now is that the MCO is not sustainable. If you look at slide 9, I'm trying to say that the MCO is not sustainable. We know it's not sustainable. It's not sustainable because for a couple of reasons. One is that I think that we are hurting some segments of our public who are very poor, those who have difficulty finding food. Secondly, we have collateral damage, people who have illnesses, who need treatment, have treatment delayed, for example, cancer or other treatment. Right? And thirdly, we're hurting all of our businesses, especially our small business. So we know we need to end the MCO. The problem is how to do it, and nobody has got a very clear way to do it.
When you say that we don't have enough data, are you suggesting that the government is withholding data that they could be actually sharing with other experts, epidemiologists, and people in your field? Or are you just saying that we're not collecting the kind of data that could be useful during this period, that we haven't?
We just don't have enough data in the whole world to understand this virus. For example, how much spread can an asymptomatic person do compared to a symptomatic person, for example? How infective are children compared to adults, for example? What's the real death fertility rate, case fertility rate? We don't know those answers very, very well. I'm answering that. Whether the MOH has got more data, I can't speak right now. But in our country, definitely we would need a lot more data. But our limitation is our testing, which limits how many people we can find out there who give us an idea how widespread this thing, which is why I showed you the ILI and SARI data, which gives us an idea of our community spread.
Well, and speaking about the lack of data, sorry. Sorry, Shira, just a quick note. I want to ask you about, speaking about the lack of data, I mean, I can imagine that there's not enough data for the people being tested and those who are symptomatic with flu-like, influenza-like illnesses. However, Amar, there's an entire segment of society that's perhaps excluded from the public health response, the migrant worker population, the refugees, those who are stateless. How are we managing that when we don't have any data for that community, for that segment of the population?
I agree. I think that's why I think we should do more testing rather than less testing. Our problem is our limitation in the volume of testing that we can do. If we had more testing capacity, our MOH has said that next week they hope to get this 200,000 tests coming from South Korea. I hope we do. You know, that is long overdue. I think if we can then use that to explore what's happening with immigrants, with different groups in the country. Also, don't forget health workers need to be tested as well. I just saw a study today from UK showing that quite a number of the health workers had got infected with coronavirus, and they're another potential spread. So I think we need to explore many different things and have a better idea of our data. Right now, I think, we are partly impaired by that. Yes.
If I could just come back a little bit to the question of the data on the people who died. And there's a lot of conversation about people with pre-existing conditions, older people, more fragile, and so on and so forth. Is there anything specific that is arising from the data in Malaysia that tells you a little bit about, are the dead speaking to us sufficient about this virus?
I think we're very clear. We've got the same picture that other people have got, that the older you are, the higher your risk of dying. If you have hypertension, diabetes, or some other chronic disease like renal disease, you're more likely to die. And that also applies to children who are fragile with chronic respiratory illnesses. So I think that data is very clear. But the deaths also speak in another way. We have almost 100 deaths. So those 100 deaths tell us that 4 to 6 weeks ago, we had an epidemic of 10,000 at least. So we must recognize that. So our official numbers are under 6,000, but the deaths tell us that if we had a case fatality of 1% of people die who get coronavirus, that means 4 to 6 weeks ago, we had 10,000 people in our community with coronavirus. What it's like today, 4 to 6 weeks later, we don't really know. There's one more thing I think we should recognize. Many countries now are plotting total deaths in the country. They plot deaths from last year and the previous years and compare with total deaths this year. And they see what the change is like. And there's a lovely paper just come out from the UK showing the big difference between deaths from this year and last year, suggesting that there are many more coronavirus deaths out there that we're not aware of. They may die at home, they may die of parent old age, they may die in old folks' home. And many of these are not tested. In fact, in UK, they estimate that twice the number of the official deaths actually have died in the community. So I think we should also consider doing that in Malaysia, which I'm sure MOH probably has a hand on that data.
Well, okay, so let's look at the question of who is dying. And people are already, and this has been said before, that many of those who are dying would have died in 3 months. It's just that the infection hastened their death. Now, I know it sounds sort of slightly tone deaf and sort of morally kind of difficult to put this, but is it just the nature of people who are fragile, that they are going to be tipped over by something? In this case, it happens to be coronavirus. Is that, what are the public health implications of sort of framing it in that way?
I think quite a few people have taken your stance, even some politicians as well. I think if you look at the whole data, I think when an epidemic spreads widely, it's not just old people who die, it's young people who die. There's now reports of young individuals in the New York area who are dying of strokes. We are seeing 20% of children in the New York area getting admitted because they're severe enough to get admitted. So I think that it's not just going to be old people that die, and it's going to creep down into the middle age and young individuals. And once the epidemic is sizable enough, we're going to see some amount of significant damage and death there. I also don't exactly share your view. I think a lot of old people do live longer periods if they don't succumb to any acute infection. So I think we should protect them rather than allow it to, overwhelm them.
Just to add, it's not my view. I'm just putting out a view that I clearly have lots of much older friends and family, of course, and I want to see them live healthy lives.
Okay, folks, we're going to take a quick break. We're going to come back and continue this conversation right here on Consider This. Don't go anywhere. Stay tuned. Thank you for staying with Sharad and I on Consider This. We're speaking tonight to Dr. Amar Singh, a senior consultant pediatrician retired from the Ministry of Health, and he has just recently written an opinion piece arguing that Malaysia is not yet ready to lift the MCO. Amar, just before the break, you talked a little bit about how the MCO has been effective, but it's not sustainable in the long run, right? Talk to us about what we need to consider as and when we're thinking about transitioning out of an MCO. What are the things we need to sort out, so to speak, before we can lift the MCO?
I think let me frame that in a broader context. Because if you look at slide number 9, I think we need for every individual, as they come out of the MCO, to behave in 3 ways. The first way they behave, on the slide I only put 2 of these ways. First way they should behave is that they should treat everybody they meet as possibly COVID-19 positive. And so they got to distance themselves. Secondly, they should behave as though they themselves are COVID-19 infected but asymptomatic, and they might give it to someone else. So they should be careful how they interact with other people. And thirdly, what I didn't put in the slide was that they should, whenever they see someone who's older, they should think that their father or mother, they see someone who's fragile with hypertension or diabetes, it's my brother or sister, and think that we don't want to lose these people, they want to protect them. I think we have this kind of frame in mind, and we can then move forward. If you look at the next slide, 10, I suggested that the MCO can only be lifted when the majority of the Malaysian public change their behavior, become responsible, and cooperate. We won't have the ability to overcome this if only 50% of people change. If 70% of people change not enough, even 90% perhaps is not enough. We need the vast majority of Malaysians to come on board. And as I said earlier, I'm not sure this is true for everybody. The fact that the police can still arrest people right now during the MCO means that after the MCO is over and the police have less powers to arrest people for this sort of thing, we may not find the same cooperation and responsibility taken.
Well, this is very interesting because, the defense that Sweden, and I refer here to the Deputy Prime Minister, has made in terms of the Swedish model is precisely this, the idea that they were going to have a milder lockdown because it was a marathon, not a sprint, and also that a milder lockdown, invoked a cooperative spirit rather than a dependence on punitive measures. Malaysia has set up prisons, all kinds of interesting authoritarian responses that we've had, which don't require a positive buy-in. And now we're saying, lift the MCO, and now we want to encourage a positive buy-in. are we kind of shooting ourselves in the foot?
Well, I think that, most countries in the world have gone for a hard lockdown. I think the minority like Sweden have gone for limited lockdown. But even though we say limited lockdown, if you read the people who talk about Sweden, their population is extremely disciplined, very responsible, and their lockdown is not as mild as we see it from here, that we see exactly what they're doing. They've actually tried to shield all the older people. You can't even stand up. If you go out to eat, you can't stand up. You have to sit down at your table and food comes to you. People are socially distancing significantly. So I think their lockdown is not as mild as we think, and we have got a very cooperative population. Government trusts immensely, and a very transparent data sharing mechanism in the country. So we've got some things going for them that perhaps we're not as up to the same mark. So I think we are different populations and different strategies required. I do believe we need to relax our MCO, but I think if you want to relax our MCO, it's got to be in stages. It can't be sudden. Maybe we can adopt what UK is trying to do, that they might allow people to visit their family only first. And then the next stage is allow businesses to get back. And as we have done, we've tried to let some businesses get back. I think what many countries have held back is on schools, because they know children, although they may not get severely ill, are vehicles to spread to their family. What many countries are very slow at adopting is religious bodies letting them get back. I think even Italy is not letting the church come back too soon. They want to hold that back to later. So I think that what we need in our MCO strategy relaxation is a stage-based relaxation to wean the public back into it. But the public need to recognize that we are not coming back to the societal and communal level that we were before. You can't sit down and just casually eat with someone. So I asked this question, are our supermarkets ready? I think they're not too bad. I wrote an SOP and I think they're pretty up to the mark, some of them. But our makan place ready? Is the average crowd in a coffee shop? Is an aircon place to eat a safe place to go to? Huh? Can children or 40 children in one classroom be a safe classroom to go to? Or would it cause spread? So I think we've not answered many of those questions.
Dr. Ahmad, can you talk us through what we need to think about when we want to lift the MCO in stages? When we're thinking about that approach, what kind of timeline should we be considering? Should we be waiting for cases to be zero? Because right now it's double-digit cases at the moment. So what's the benchmark that we should be using in terms of thinking about lifting the MCO? I'm looking at Hokkaido. Experts are saying Hokkaido lifted their lockdown a bit too early, and now they're seeing another wave. What are your thoughts?
I think Hokkaido is a good example. I think they did a very good job, and then they had a slip there. Now they are back to lockdown. I think that we're in uncharted territory in answering this question. I think no one's really able to answer your question. I think we could look at all the countries around us that are trying. Look at Sweden, which is different way they're doing it. We look at China, look at Italy, look at South Korea especially, look at Taiwan. I think, and also the UK. I think these countries will give us an idea which way we can go. Of course, one very important thing is we shouldn't have community spread continuing, and that requires a lot of monitoring that we need to do. But remember that whatever we do today, the impact is going to be seen in 4 to 6 weeks, and that's part of the problem. This lag time, it's going to create a bit of a problem, whichever measure we take. But as we know, we need to stagger this. We need to do it slowly. In UK, what they've done now, they've suggested that people, maybe they can meet families. In Italy, they're saying you can go back to some businesses and they can go out into the park. And I think Malaysians would appreciate very much being able to walk around a little bit and do a bit of exercise. I think that, so we can open industries as we are doing partly, and then maybe offices after that. What people have been very slow in deciding is not school, because we know children can spread the virus. And people have, of course, been very, very slow at religious organizations. And in Italy, they're very slow at opening the church because they worry about the spread there. But I think if you think through the whole issue, let's take an office, for example. Let's say we want to go back to an office. Can an open office work? An open office is very dangerous. We see data from South Korea, from a call center, which is an open office environment, showing how many people got infected from one person, mainly because of the air conditioning. I think air conditioning is an issue in all offices. Secondly, toilets are common user items. How are we going to handle a toilet which is a lot of spread happening? What about lifts? So many of our offices in KL, in Ipoh and Penang and so on, are office tower blocks. How are we going to put people into a lift and spread the virus? How long are you going to wear a mask? Maybe what we can do is perhaps stagger our office hours. Some people would come in from 8 to 12, and then a second group would come in from 1 to 5. There are many issues. In particular, I'm worried about the toilet, the aircon, the lift. I think that's important. Of course, staff meetings are a crisis. So anyone who can work from home. Any meeting we have virtually. So I think we need to think through all these issues, have a checklist, have a standard operating policy. Everyone gets trained in it, and we follow this as our new norm. And that's a way to reduce the virus spread. It's not going to go away, but at least we can keep it. I want the curve to be flat so that we can cope with it. But I think that one of the things that we are not recognizing right now is our healthcare personnel are exhausted. They've been going on for 2 months to 3 months, just maintaining this vigilance, wearing their PPE and stuff. Some of them haven't even gone home to see their children. They put their children with their grandparents or somewhere else. How long are they going to maintain this? And so I think as a public, we need to have responsibility to really keep the virus at the lowest place possible so that healthcare professionals also can get back. I think we need to rotate our health staff as well so they get some break as well. And I think we really must ramp up our health services. We must have an access right now. We need a lot more hospital beds, a lot more ICUs, even though we don't need them right now. We must come to the place where we have one day we laugh about this and say, oh, we don't need all this stuff because we just might need it. And if we don't use this time wisely, then we will fail later.
Amar, thank you. Thank you so much for your time. Appreciate your time. That's all the time we have on the show tonight. I will be back same time with you tomorrow night with Sharad Kuttan. We're signing off for this evening. Thank you so much for watching and good night.
Good night.